Mhm. All right. Thank you everyone so much for being here. My name is Leah Raffa. I use she, her pronouns, and I am with the DPS Substance Use Prevention Program. And I'm so excited today to welcome Shelley Mann-Lev with the Opioid Response Network. Shelley has 20 years of experience as a director of school prevention programs. Um, and she's here to talk to you all about what parents need to know about drug overdose prevention. Shelley, thank you so much for being here. And Shelley, you're muted.
We are always learning Zoom and always learning new things. And I hope that today's webinar will be an opportunity for you all to learn this about something that is extremely important to our families, our youth, our schools, and our community. We're going to be talking about fentanyl. And let me share my screen. My name is Shelley Mann-Lev, as Leah said, and it's really an honor to be sharing with you about what parents, families, communities need to know about drug overdose prevention. I work with the Opioid Response Network as a prevention consultant, and yes, 20 years is a long time. And, sometimes I think my credentials are not only 20 years of that work, being the co-founding director of a prevention coalition, working with communities all over the state, community education policy, and with the schools. But also I've had the joy of being a parent. I say joy because we know it's joy, heartache, all of the above. And I'm so appreciative of all of you who take on that responsibility. I work with a group called the Opioid Response Network, and that network works with states, organizations, and individuals like the Denver Public Schools to help provide the support around the opioid issue. It is available to anyone in the community, anyone who works for an organization or a government agency. And by contacting the Opioid Response Network, we hope that we can all make a difference together. It's one more partnership, and we need partnerships. We work as facilitators, we work as presenters, and like I said, I mostly work in the Southwest. I'm from Santa Fe, New Mexico. Colorado, New Mexico are neighbors, and our issues, our challenges are different and similar, and we can all learn from each other. So, welcome. We're so glad that you're going to be spending this time with us. And here's the tone we hope for. We want to learn through facts, not fear. For those of you who are familiar with fentanyl, it can be scary. Fentanyl is a very lethal substance, and it is hurting our communities. It is, in some cases, actually youth are dying from fentanyl-related overdoses. So it's serious. We want you to take care of yourself, make sure that we breathe, make sure that we are nurturing ourselves, as well as really thinking about what we can do for our youth to keep them safer. So what is one thing you hope to get from today? If you want to put something in the chat, it'll be interesting for me to see, but really want you to think just for a moment, take a breath, and what would you like to learn about fentanyl today? What we are going to learn is about what's happening with youth substance use and overdose. We're going to talk about stigma. It's so important before we do anything else to talk about stigma, because shame, blame, bad, those are scary, yes, but those are things that make it difficult for us to do the learning and the talking, take the steps that we need to take to help keep everybody safer. We're going to talk about the risks of fentanyl and ways to help prevent substance use and overdose death. And finally, I'm going to share with you some resources to help youth and family deal with substance use and other challenges. So, of course, many of us have heard just say no and oh, but what we need to do is say no, K-N-O-W, knowledge, right? Why are you listening to this webinar? Why are you participating? It's because you want to learn more about how you can protect your children, your family, and our community. And what we know, especially about teens, is that scare tactics really don't work. There's something to seriously be afraid of with fentanyl. But even as we talk here, we're not going to show videos of crying parents. We're not going to show videos of, emergency room scenes. Some of our young people will say, and maybe you even think, that's the drug education we used to do in the 90s, right? We used to do in even the 80s. Just say no, don't have to say anything else than that. It's a lot easier, right? No, yes. But unfortunately, the youth that we need to reach are not the youth that are going to be impacted by those scary scenes. That's not what's going to change their behavior. It's having the facts, strengthening their protective factors, and helping them be prepared to reduce the harm in dangerous situations and take the steps they need to protect themselves. Substance use is a part of our culture. Everyone does not use drugs, but some people do. Every teen does not use drugs, but some do. And today's drugs are more deadly. And again, we're going to talk about ways you can actually help to prevent substance use. The safest way to prevent an overdose is not use anything at all, right? Not to use any psychoactive substance, not to use any pill or powder. We can also do things to prevent an overdose, and we're going to address that. And finally, there are also ways to help if somebody has a drug overdose, and we're going to talk about those too. Because again, as family members, community members, people who love the people around us and care about people, we want to make sure we know what to do. So I said stigma, and let's start with person-centered language. As Jerome Adams, U.S. Surgeon General, back a number of years ago, said that the biggest killer out there is stigma. Stigma keeps people in the shadows. Stigma keeps people from coming forward and asking for help. Stigma keeps families from admitting there's a problem. And that secrecy, that shame, that sense of blame, of self-stigma, the stigma we do with others, keeps us from learning what we need to learn, keeps us from taking the action we need to take. I want to share a little more about what you can do about stigma, because stigma is part of what we need to know about addressing fentanyl. We can use positive, respectful, person-centered language. What do I mean by person-centered language? When somebody has diabetes, it's respectful to say a person who has diabetes. They aren't their diabetes. They're a person who has diabetes, right? If somebody has heart disease, if somebody has, whatever the condition is, there's somebody who is with that condition. It's not who they are. And the same thing is true about substance use. If somebody has a substance use disorder, they're a person with a substance use disorder. If somebody is using a substance, there's somebody who's used a substance, but they're not labels. And those labels really hurt people, hurt the family members who love those people. And again, that create a secrecy and a hiding that make it difficult. You're here today because you want to learn more about substance use, and we'll talk a little bit about mental health challenges. Learning more is a way that you can address stigma. And of course, I don't know, we talk with our young people sometimes about bullying, and, it's the people around, what we call bystanders, or I love the term upstanders, the people around them who can do the most to address stigma. And by stepping up and, if you hear words like addict, you can say, that person is struggling with a substance use disorder. If you hear people using language, the shaming, those kids, right? Tone of voice. You can say, those kids have strengths and challenges like all of ours, right? So when you hear stigmatizing language, when you hear people using those kinds of labels, and I'm not going to repeat the labels, with love and care, gently saying, and that includes with your youth, with your children, right? Because we're teachers around language and care and respect as much as anything else. You can share wisely about your own substance use and mental health challenges. If that is something you have struggled with trusted people in appropriate situations, to share that. Obviously, you want to be wise, but that's a way of addressing stigma as well. Advocating for respectful and kind treatment of those who use substances and their family members. And then finally, to become an ambassador. One of my hopes from this training is that you will be a fentanyl awareness ambassador, that you will be one of the people after you participate in this workshop who can, again, make sure that people have the facts and tell people that prevention really does work, including overdose prevention and response. Treatment really does help, and recovery is possible for most people. It can take time. We know with a disease, for example, like cancer, sometimes the first treatment doesn't work. It can take a year, it can take longer, but with support, people can recover, and that includes you who struggle with substance use, who develop a substance use disorder. They too can recover with the right kind of support and help, and again, without stigma. I do want to share a resource with you from a group called Families Against Narcotics. It was started by a mother who's a judge in Michigan. And again, it gives you a sense of what one ambassador, one motivated person can do. She gathered together other parents and formed an organization that supports everything from treatment, recovery, harm reduction, meaning helping people reduce the harms associated with substance use, because without reducing those harms, if a person's not alive, they can't recover. So, and as part of their work, they're doing some beautiful work around stigma. And they have published a book called I'm Still a Person, right? The Stigma of Substance Use and the True Power of Respect. So I encourage you to take a look at that. Judge Linda really has done incredible work. And again, we each have our part to play. We are each partners in addressing substance use and the challenges. So I want to ask you a question, and please feel free to put your answer in the chat. How familiar are you with fentanyl? Very familiar? Somewhat familiar? Never heard of it? I'll wait a moment. I think if we had asked this question a year ago, 2 years ago, maybe most people would say never heard of it. Now I think most of us are somewhat familiar, and some of us are very, very familiar. My goal after today, I hope your goal is you will be very familiar with fentanyl. How comfortable do you feel talking about substance use with your children, with your child? Very comfortable? You're already doing it? Very comfortable, but you haven't talked about it yet? Somewhat comfortable? Not sure how to start that conversation, or very uncomfortable? One of the things, please. Okay, thank you. You can't put that in the chat. So just by asking this question, you kind of note for yourself, because those are the questions I want to have you ask yourself when we finish, right? How comfortable are you before you started this or afterwards? You don't have to be very comfortable to have a conversation. I think that's one of the things, even in doing these kind of webinars, and, Leah said, I've got many, many years of experience in working with communities, parents, young people, and I still feel somewhat uncomfortable. That's just how it is. I take these things very seriously, and I have to say, talking about substance use for many of us, it's not the most comfortable topic, but we can still do it. And the most important thing is to do it. We can even acknowledge, we can even say, I feel a little uncomfortable, but I really care about you. And I really want to make sure you have the information you need because I care about you. So we're going to start kind of with the stark, difficult facts, which is more people are dying of drug overdoses in the United States than ever have before. You look at that line, it's pretty stunning, isn't it? Drug overdose deaths in the United States for the first time ever in 2021 topped over 100,000 people. 100,000 people. That's a stunning figure, right? It's 300 people a day dying of drug overdose deaths. And as you can see by the gray bar, 2/3 of those are from fentanyl and other synthetic opioids, and almost all of those are from fentanyl. What do we mean by synthetic? We mean they're made in the lab. They're from chemicals, not from poppies, right? That's the difference between a synthetic and a plant-based opioid, like heroin. And Colorado is no different. It's provisional data for Colorado, but overdose deaths in Colorado, especially from fentanyl, and these are the fentanyl deaths, have been increasing. You can see back in 2015, 2016, 2017, under 100 people, but things started to change, and they really started to change. In this time period, we hit 100 deaths from fentanyl in 2018, and we're almost up to 1,000 deaths from fentanyl in Colorado, at least a 42% increase over 2020. Not the change we want to see. We're going to learn again why fentanyl is so deadly. Fentanyl is killing lots of people, but in particular, fentanyl is killing younger people. When I first read this, I was stunned. I don't know if anyone's heard the term gobsmacked. English friend of mine from Great Britain uses that term, but shocked, surprised. Fentanyl is now the #1 cause of death for Americans between the ages of 18 to 45. This is from a group called Families Against Fentanyl. These are people who have lost a child from fentanyl. It caused more deaths in Americans in this age group than suicide did. It caused more deaths than motor vehicle crashes. It caused more deaths than gun violence. Fentanyl is the #1 cause of death for Americans, young Americans. And teens are not immune. People as young as 10, 13. As you can see from this fancy graph, I'm going to point to, I don't know if you can see my pointer, but this gray line is fentanyl-related deaths that included fentanyl overdoses, ages 14 to 18. And in 2020, it jumped, it doubled from 2019. Of course, we know what happened in 2020, the pandemic started, and fentanyl started appearing in more and more pills and powders, street drugs. And then 2021, it jumped again. We have, as you can see by the numbers, right, in 2019, almost 500 young people in the United States, 2020, almost 1,000, 2021, 1,146. It's preliminary data, but it's enough data to tell us that youth are dying. And I have to say, again, I didn't want to, bombard you with videos and with pictures or images or truly parents who are grieving. But in looking at the news in 2022, Colorado youth continue to die. We have here by age 29 kids, ages 10 to, it's not 28, I'll change that, 10 to 18 died from fentanyl in Colorado during the 2021-2022 school year. That means last year. We have documented from the Colorado Department of Health and Environment. 29 kids. And, you know, since they all have names, they all have families. Kimberly from Lakewood, 16 years old. Ty from Douglas County, 17-year-old. Josiah from Arvada, 13-year-old. All of these young people have been lost to us, to their families, and all the people around them. And we want to do what we can. So I do want to tell you one thing I think is really important, and that is that youth substance use is not increasing. You can see from this national study done, it's called Monitoring the Future Survey, and done from all over the nation, that actually during the pandemic, fewer youth reported using substances. But even before the pandemic, we don't know, you know, this was done in 2021. You can see in 12th graders that fewer than half, 40% of 12th graders had reported any past year, having used any illicit drug in the past year. 30% of 10th graders, fewer than 1 in 5 8th graders. And that actually went down in 2021. But the drugs that they're using are more deadly because of fentanyl. So our teens are overdosing on fentanyl that most of them don't know they're ingesting. They didn't mean to ingest. We call that an accidental overdose. They didn't want to take fentanyl. They were told this wasn't fentanyl, but fentanyl is showing up in many, and in some cases, most pills, powders. What they're getting, and you'll see pictures of this later in the presentation, looks like real prescription pills or other street drugs, and lots of it is out there. So more kids are not doing drugs, but the drugs that are out there are more toxic and lethal. And it's impossible to tell the difference from a fake pill with fentanyl to a real prescription pill, from cocaine that's been mixed with fentanyl to cocaine that's pure. So what is fentanyl? Synthetic opioid. It was actually first synthesized in a lab in 1960 and started to be used clinically in 1963. And it is an incredible prescription medication, prescription painkiller. It's used to control severe pain, you know, patches. It is safe. It's injected as well. It is safe when prescribed by a medical provider and used as directed, carefully monitored. Why does it have to be so carefully monitored? Of course, in a medical setting, it's produced in a highly regulated manufacturing facility, right? Very, very carefully monitored, tested so that we know the dose, because fentanyl is extremely potent. It's much stronger than plant-based opioids like morphine or heroin, 50 times stronger than heroin, 100 times stronger than morphine, much stronger than oxycodone or Percocet. So it is highly potent. Every pill starts as a powder. It starts as a powder. It's cheap and easy to make. The chemicals made in China mostly, maybe some other countries. And, you know, it doesn't take a degree in chemistry in a lab to produce fentanyl. And it only takes that small amount to have a big effect because it's so potent. So it's replaced opioids because it's easy to get. And because it's so potent, just a tiny amount can have a big impact, makes it much, much easier to ship, right, to deliver. And because it's cheap to make, it means it's very, very profitable for those who are trafficking in drugs, for our drug dealers. I just want to show you a couple of images. People choose different ones, but this is how little fentanyl it takes to be a potentially deadly amount. Just enough on the tip of a pencil. You can see that amount, you know, think the size of penny and just the comparison, right? It's just a few grains, like a few grains of salt or sand, as little as 2 milligrams. For somebody who has been regularly taking opioids, they might be able to tolerate more fentanyl. But for somebody who doesn't take opioids, who this is their first time or second time, fentanyl can be lethal if it's in the drug you're taking. And you can't see it, taste it, or smell it. It's odorless, tasteless, colorless, which means it's hidden. And it means that any pill, line, bump, or hit, if it's a street drug, could be the one that causes an overdose or poisoning. Even if in the same batch, you're with a group of friends and you've got a bag, you've got lines of cocaine, whatever it is, and two people can take it. You know, in the case of one of the recent reports out of Southern California, one girl died, the other didn't, because it's not evenly distributed. We're talking about drugs made in a street lab, made not under careful regulation, but potency varies. So you can only know for sure about a pill if it comes from a licensed pharmacy. It's not evenly distributed. Someone could swear and tell you these oxycodone, these blues, M30s, that's their names. I know they're the real deal. Doesn't matter who they are. Friend, someone you know, you can't trust it. And while we have something called fentanyl test strips, which I'll share a little bit more about, which can check for fentanyl, can't tell you how much. It can't tell you whether there's a tiny amount. It can't tell you whether there's a large amount. And what we're finding from the DEA and the drugs that they are confiscating, that they are seizing, is that of the drugs that contain the substances that contain fentanyl, the pills, almost half of them actually have that lethal dose. So it's in our drug supply. The amount of drugs that are being seized is just mind-boggling and increasing every year. So I want to give you some examples of drugs that contain or often contain fentanyl these days. Oxycontin, oxys, the blues. These days, if somebody doesn't have Oxycontin from a pharmacy with their name on it and their prescriber, right? It's likely to be all fentanyl. Again, it's cheaper, easier to make. Percocet, fentanyl, many cases. Heroin, people who regularly use heroin, well, you know, that's the drug they want, can't get it anymore. You know, I was just talking with folks from the Denver Harm Reduction Program who work with people who use drugs, and heroin just isn't available. And that's true across the country. They're using fentanyl. It may be called heroin, but it's not. Stimulants like meth and cocaine, it's can be mixed with fentanyl. And Adderall, you know, many of you may know that it's used to treat attention deficit disorder, ADHD. And unfortunately, again, Adderall that you get from a friend, you get from a dealer, you get online, may be contaminated, may be laced with fentanyl. Same is true of ecstasy, mollies, MDMA, and tranquilizers. And with something like tranquilizers, like Xanax or other benzodiazepines, many people know them as benzos, fentanyl, like all opioids, depresses the respiratory, makes it harder to breathe. It slows down your breathing. And when you mix in a benzo, alcohol, Xanax with fentanyl, it multiplies the effect, which makes for a more deadly risk of overdose. So here are some pictures. Can you tell the difference, right? People sometimes hold those up. Real oxycodone, fake oxycodone. Impossible to tell. Again, the blues, M30s, and as people who work with people who use drugs say pretty much on the streets, oxycodone is not oxycodone. It's fentanyl. It's a fake pill. Xanax, does it look any different? You know, it's not hard to get a machine that presses and looks just like it. And then the next day you make the blues. People do different things in different machines. Adderall, it looks the same. So if you get a drug on the street, there's a chance it's going to contain fentanyl. And how are our youth getting it? Well, this is the headline from the New York Times. Fentanyl tainted pills bought on social media cause youth drug deaths to soar. Teenagers and young adults are turning to Snapchat, TikTok, other social media apps to find Percocet, Xanax, and other pills. The vast majority are laced with deadly doses of fentanyl. Police say, depends upon the pill. Certainly, in the case of opioids, it's true. With other drugs, it varies, but you can't be taking those chances. I have to say, listening to the Drug Enforcement Agency, the DEA, who put out this, emoji drug code decoded, these emojis change all the time. Even the platforms change all the time. But this is the new, who needs the US mail? Who needs the drug dealer in the car lurking on the street corner? Online, that's where most of our youth are getting drugs. And or from their peers, friends, someone they know who's gotten it online. And again, so easy, cheap to make, easy to get. And that pill they take may have fentanyl in it. The DEA put out their first public safety alert in many years on September 2021. They are deeply, deeply concerned about how available these fake pills, prescription pills are, and the powders. Again, telling us they look like Percocet, Oxys, Vicodin, Xanax, Adderall. And about 40% of the pills that have fentanyl in them contain a deadly dose. So we're halfway through. You know a lot about fentanyl now, right? You know that it's potent. You can't see it, taste it, smell it. You can't know that it's there. You know it's cheap, easy to make. You know it's often replaces opioids. Fake pills, hard to tell. You really can't tell the difference. It doesn't come from a pharmacy. Again, in a pill, your name on it, your prescriber, bought from a pharmacy, picked up from a pharmacy. There's a chance it's fentanyl, or it's laced or mixed with fentanyl. So this is our continuum of care. We need to be involved in promotion, encouraging people to be healthy and well, prevention for all audiences, for everyone, those that are highest risk and those that may have started using a substance, treatment and recovery. And our work with preventing fentanyl needs to be not just with people who use drugs, but those who might try it for the first time. Because unfortunately, now, the first time could actually really harm somebody. They could overdose or even die. So basic prevention around medication practices, we've been talking about this. I think most of you are familiar. You need to keep track of your meds, right? You've got to keep them safe, locked up, out of reach, out of sight, especially medications like opioids. Used to be that our youth knew somebody wanted to get an opioid, their grandmother's medicine cabinet, right? But when you're done, you want to dispose of unused medication properly. You obviously want to take it directed, ask questions, talk to your provider, not share meds. I mean, these are kind of the medication basics. And then hopefully you have a drop box, and you don't want to be, disposing in trash or the toilet. You want to take it back to a safe take back location, or use something like a deterrent bag. And many of our, in Denver, I know you have resources for that. And please make sure you keep medication safe. And that can start, this kind of education about self-medication practices can start at a young age. You don't take something that your parents don't give you that didn't come from a doctor. It's really basics. So I know this chart looks a little bit overwhelming, right? But I want to talk to you a little bit about risk factors and protective factors. What is a risk factor? It's something that increases the likelihood, makes it more likely that a youth might use substances. Because remember, if you go back, how many youth use substances? More than half don't use any illicit, illegal substances. So we want to do what we can to minimize risk factors. We can't get rid of them all, but we can do what we can to minimize them. And what we most want to do is optimize those protective factors. So let me just share a little bit about those. In terms of risk factors, if you have a family history, or if someone in your family currently is misusing substances or has a substance use disorder, that increases the risk for a young person. Doesn't mean having a risk factor doesn't mean that young person is going to use substances. But again, if that's true, we want to make sure that we're doing everything we can to strengthen those protective factors. Other risk factors, people who experience violence, young people who experience violence around them, people, young people who have access to substances around them, who don't have economic resources, housing, that puts them at more risk. Trauma and stress, some of you may have heard about ACEs, adverse childhood experiences, but the more trauma a young person has undergone, and especially if they haven't been supported or haven't been able to develop coping skills for dealing with that, puts them at risk. Some people talk about substance use as a way to self-medicate. We want to address mental health problems, trauma and stress through positive supports, but those are risk factors for substance use, especially in terms of mental health, anxiety, depression, or attention disorders. For a young person who's struggling with school, they're more likely to get engaged in substance use. And then peers, who are they hanging around with? If peers are encouraging them to use, they're more likely to use. And finally, and I really want to bring us back to parents, because parents make a big difference. And in fact, studies have shown that when parents, and this is a protective factor, when parents express their disapproval of substance use, it's not okay for teens to experiment. When parents share that, I love you, I care about you, here's some ways you can be safer if you do, but in our family, please, 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 we need you to take care of yourself. I don't want you to be using any drugs or alcohol. Those are the risk factors. And again, what's so helpful is the protective factors, the things we can do. So parent, caregiver support and involvement, your involvement with your kid is a protective factor. Positive connections with your family. Studies have shown actually that eating meals together, maybe it's dinner, maybe it's breakfast, maybe it's only on the weekends. I know, we struggle as families, but having that time together, and if it can't be a meal in other ways, positive, being connected to your family, and having friends, peers, having strong positive connections, being involved with your community, being involved with groups, with church, with faith-based organizations, with other activities, sports, is a protective factor, as well as having good coping and problem-solving skills. That engagement in school, right? Learning, caring about your learning, peers, sports, work, spirituality, and your culture, those help give kids the strength to be positively engaged in their life. And all of our young people need a trusted adult. Sometimes in the teen years, it might not be you as a parent, caregiver, other trusted adults, aunties. I know I'm an auntie to a number of young people, and it's an honor, right? It doesn't mean I'm their aunt, I'm their auntie, and both in and outside of the family. And also young people who have goals for their future are protected. So we want to do whatever we can to build those protective factors. And of course, parents are an important part of protective factors. So as parents, hopefully you're helping grow resilience. It gets more challenging as our young people become teenagers. Their urge for novelty, that's spark of creativity and exploration, for some of them, the thrill seeking, that they need the stimulation, but we can help direct that in positive ways. We can earn their trust by being truthful, We can support them to form relationships with other trusted adults. We can get to know their friends, their peers. We can help them find their passions, and we can monitor activities, especially online. You know, the phones, these appendages that are so important to all of us, right? When your child is a teenager, you can be with them, ask them to show you what they're doing, and as much as possible, help them be engaged online in healthy ways. You can also encourage them and support them in getting involved in meaningful activities and letting them know your expectations, including about substance use. Finally, and where we'll, when we get to the end of this, really talking about watching for signs of distress and reaching out for help if needed. So let's talk about talking. How do you talk to your kids about fentanyl? There's a lovely handout that some folks in Seattle created, which you might find helpful. And I know the links are part of this slide deck. But teens need love, support, and good information from trusted adults. And you can start the conversation, just do it. Even if it's awkward, and maybe it's not awkward. I just watched this webinar. I just saw something on the news. There's many moments of opportunity to start that conversation. And again, starting by saying, I really care about you and I want to help you be safe. I care about how you're doing, and I'm hearing things that make me very concerned, and I want to know what you know. So the first place to do is to listen. What do you know about fentanyl? I just learned some things. Love to hear what you know, and to listen. What's great about that is they may know more than you do, and they may have some myths, and we'll talk a little bit about those myths. Explain the reality. Teens are dying of overdoses. There is a risk from any pill or powder, right? Any drug that you don't get from a licensed pharmacy. Even if someone told you they got it from one, right? You can't know for sure. Even if one pill somebody already took, you don't know about the other pills. There's a real risk. And then you can talk about how they can get naloxone, a remedy for overdose that we're going to talk about in a minute, and fentanyl test strips, and encourage them to be an ambassador just like you, to look out for each other and let them know that you're here to help them learn, survive, and thrive. And that hopefully they can talk to you or somebody else that they trust if they're struggling in a situation. That's prevention. However, as we know, there are some young people who are going to use substances, and we want to prevent an overdose death. Keeping our kids safer, we keep kids safer in all kinds of ways. We know that, the sun, the term is called harm reduction. We know the sun can cause skin cancer, so we use sunscreen. We know driving in a car, it can put somebody at risk of a car crash. We wear seatbelts. Not 100% protection, but it is protection. And thankfully, in the case of fentanyl, there are some ways that we can stay safer. There are some ways we can reduce the harm of using. And the most important one of those for us to look at is naloxone, Narcan. Anyone can get naloxone, no matter their age, and we encourage everyone to have it in their first aid kit. If there's any chance that one around you is taking a prescription opioid, if you've had an injury or dealing with some kind of acute pain situation, knee replacement, people need prescription opioids. It's, they have their place for acute pain, just as even fentanyl has its place for severe cancer-related pain. However, anyone who's has a prescription opioid in their home, or who might have someone in their home who has taken a pill or powder that could have fentanyl in it. I carry Narcan. It's available in Denver. There's a QR code to get it free, along with fentanyl test strips, and it's very easy to use. I'm going to show a little video about how to use it so you can see how easy it is to use. But first, let me just talk briefly about signs of an overdose. Person is unconscious, doesn't respond, won't wake up. They're not breathing enough. They're breathing shallow, or not breathing at all. They're turning blue, especially on their lips or fingernails. It could be an overdose. Unresponsive, irregular breathing, their skin color again, pupils very constricted. When you respond to an overdose, the first thing is to call 911 and then administer Narcan. You wait 2 minutes between doses. And let's see if I can play this video. I hope I can. There it is. I'll make it larger. What happened? Well, I'll stop my share on that and not do that. The videos, and you can get many, many of them on all different ways. Google administering Narcan. It's very simple. And it is, a nasal spray. And the beauty of Narcan is if it is an opioid dose, it works. Even if it's an opioid overdose, if it's an opioid overdose, Narcan is amazing. It immediately replaces the opioid in your opioid receptors, and people wake up. Depending on the intensity, how much opioid someone has taken, it might take more than one dose. So you wait between doses to see. You've called 911 because obviously we don't know if this is an opioid overdose, could be something else, another kind of medical emergency, and we want our first responders there, and all of them these days carry Narcan. Another way to keep people safer, especially people who know they're going to be taking a drug, is a street drug, is fentanyl test strips. And testing drug supply is another way to reduce the harms. These fentanyl test strips are available, again, through the city of Denver. They're simple and expensive, easy to use. Generally, they cost less than $1. Again, Denver's giving them out for free. Many different programs give them out for free. They're small strips of paper, right? They only give you a yes nor no answer. And we know potency matters. Hopefully, if a test shows that there is fentanyl in a substance, someone will choose not to take that to get rid of it. In other cases, somebody might choose to use just a little bit. And of course, to make sure someone is nearby who has Narcan. I think in these days, for our youth, we don't want them to use any street drugs, any illicit drugs. And if they're going to, they feel like that's what's going to happen. We want to make sure they are with somebody else and that person has Narcan. So the best way to protect yourself from a drug overdose is to not use alcohol or other drugs. You won't overdose on a drug. You won't overdose on fentanyl. If someone does use drugs or alcohol, street drugs or alcohol, not to mix substances, especially alcohol, opioids, and those benzodiazepines like Xanax. If you mix alcohol and an opioid, it greatly increases the likelihood of a deadly overdose. Never use alone. If you overdose, there's no one there to rescue you. To start low and go slow, use a small amount over a long time, and then to know how to respond in an emergency, calling 911, giving Narcan, if at any chance it might be an opioid overdose. If it's not an opioid overdose and you've given somebody Narcan, it has no effect. Doesn't matter. And you are fortunate in Colorado that you have a good Samaritan law that protects people from arrest for drug possession if they call for help in an emergency. And I have to say, when there's an emergency, when somebody is unconscious, not breathing, and you call for help, the first responders want to protect people. So that Good Samaritan law is in place. There is some question with fentanyl, what will happen, but they're there. And the most important thing is that your friend is alive. That's the most important thing, to get that help. So I know this kind of information can make parents feel uncomfortable. You know, we don't want our young people to be using substances. We don't want them, in many cases, you know, to be having sexual intercourse. Talking to young people, telling them we want them to wait, right? Whether it's about sex, we want them not to use drugs because that's the safest for their developing brain. And we want to talk about how they can enjoy their lives and be creative and express themselves and be with their friends in other ways. But they or one of their friends might choose to use a substance. So having this information that fentanyl is in most, has replaced most opioids, those blues, heroin, Percocet, mostly fentanyl, almost always fentanyl now, and just a tiny amount can be deadly. And then if they are, please don't take alcohol with it. Don't use alone. Make sure someone's there with Narcan. Carry it yourself so you can save a friend, right? And many people, you know, that sense of low and slow. So a couple of myths, because you may get asked and because it's important for you to know. Fentanyl is not Narcan resistant. It does respond to Narcan. It may take more doses. And then the big myth is you can't overdose simply by touching fentanyl or being in a room with somebody who took fentanyl, breathing it in somehow. It's got to be in the bloodstream or mucous membrane to feel the effects. And, you know, there's an amazing recent story of somebody who, you know, himself as a scientist testing fentanyl in the lab, and it spilled on his hands. And, you know, it was a case example. He did not overdose. You know, the fentanyl patch has an additional chemical in it to make sure it's absorbed by the skin. Touching fentanyl, it is safe to be around somebody. You know, we do want to take protection from all things if we can, but it's safe to give somebody Narcan. You're not going to overdose around them. And those myths keep us from reacting. So sometimes we need help. All of us need help. So get the support your children need. Some signs of youth substance use, which might be one reason you need help, is you're worried, you know, warning signs of substance use. Changes, those are the most important thing. If your young person is somebody who always dressed a certain way and kept themselves clean, and all of a sudden they never take a shower, right? They start to smell, their clothing's disheveled, torn. Changes. Usual hobbies, things they're involved with, the way they, you know, perform in school, family, and all of a sudden they're not interested in anymore. Changes in their friends. More illness. You can't wake them up. You know, we know they like to sleep in, but you can't wake them up. They sleep a lot. You can't get them up. Changes in mood and personality, extreme mood swings. Yes, you know, our teenagers have mood swings, but we're talking about things you know in your gut. You know, it reminds me, they tell us as parents, when you have an infant, you know, a baby, right? Well, when a teenager really changes, they might be dealing with substance use and being secretive, keeping secrets. So what kind of resources do you have? Denver Public Schools has incredible support in the school building. Some schools have school-based health centers. Some schools have school health professionals that are specially trained. There's school nurses, school nurse supports. There's school counselors, or social workers, or psychologists, and also teachers, coaches, somebody you trust, somebody your child trusts. In the community, Denver Health offers a STEP program. It's available through the school-based health centers, but also available in the community. It's really an evidence-based program that can support youth who are struggling with substance use. And then you can also go online to SAMHSA or call 1-800-662-HELP. And you have a crisis line at Metro Crisis Services, which is available to you. Denver Prevention Programs, the Denver Public School Prevention Program has a wonderful resource list you can download at dpsprevention.org, and it's kept up to date. It can share resources with you. So as we near the end of this, I wanted to find out if anybody has any questions.
Just like a tower.
Thank you, Shelley. That was amazing. If anybody does have any questions, please go ahead and either raise your hand and I can unmute you, or you can put those questions in the Q&A space.
And it's like, get in the driver.
I think that was just a very comprehensive presentation, Shelley. Thank you so much. Oh, we've got a question. Nope, really great information. Echoing my thoughts as well. So thank you so much. Please feel free to reach out if anyone has any questions, but thank you all for coming.
And thank you all
So
for
yeah,
being
no, you're doing good
for your community.
Thank you, Shelley.